That all sounded much more impressive than I really am. Okay, so we have no. You're good. This is my buddy Ryan. He helped me out last time. He's an awesome IT guy. Alright, so I'll just point at you when we're ready to go. Okay, so, okay, you can go to the next one. I think that's just all my qualifications that were already listed. So I am board certified in family medicine. I'm also board certified in addiction medicine, but I work at 4 different facilities, so I basically just work in addiction medicine. So I see addicts all day, every day. So I understand that right now everyone is overwhelmed with the opiate problem. And it seems to be bringing this issue of addiction to the forefront, which is good because awareness is really important. But in my world, focusing on one specific drug is a really bad idea. What we need to do is we need to focus on the disease as a whole and look at how that drug works within that disease structure. So what I aim to do, what I generally do with this talk, is we're going to talk about why addiction is a disease. Why do we call it a disease? So that insurance can pay for it? Maybe, I don't know. No, we call it a disease because it fits into the category of a disease. So how does it do that? Because when I say to you, cancer is a disease, you say, yes, it's terrible, my grandmother had it, or my uncle had it, or whatever, we know. But when I say addiction is a disease, even people that work in the field of addiction medicine go, well, yeah, I mean, intellectually, I know it's a disease. But it looks like really bad behavior. It looks like people that don't care about anybody but themselves. It looks bad. And so the question becomes, how do we call it a disease? How do we say it's a disease? So in the world of medicine, in order for something to be called a disease, it has to fit into our medical model, the disease model. Back in the days of the Greeks, they used a humoral model. So they would drill holes in people's skulls or do bloodletting to let demons out and things. That was their medical model. That was how they practiced medicine. Today, we're a little bit more advanced. So we use something called the medical model. And essentially what a medical model says is in order for something to qualify to be part of the disease club, there has to be an organ, there has to be a defect in that organ, and there has to be symptoms related to that defect. So for example, in diabetes, the organ is the pancreas, the defect is a decrease in these beta islet cells and insulin production, and then the symptoms are high blood sugar, retinopathy, etc. Right? If I break my thigh bone, the organ is the femur bone, the defect is a fracture, and the symptoms are screaming, bleeding, deformity, etc. Okay? That's how we fit it into a disease model. So the question becomes, how do we fit addiction into that model so that we can say, yes, it's a disease? Because I'm going to tell you, you cannot treat a disease if you don't even understand why it's a disease. You can't treat anything if you don't understand it. So fixating on one specific drug is not going to help the problem. We need to understand the disease process first. So, addiction is a brain disease. It is not a moral failing, and it is not simply psychological illness. It is actually a neurological disease in the brain. So, we're already starting out at a disadvantage because even people that specialize in the brain don't know that much about the brain. They just don't understand it. It's a very complicated organ. What we do know is that the brain is responsible for everything: walking, breathing, thinking, feeling, and we don't really understand it. So we know that defects in this organ cause symptoms that look like behaviors. When someone has a brain tumor in a certain part of their brain, their personality can change, their judgment can change, their ability to rationalize and reason can change, their ability to do math, spelling, and speaking can change. So diseases of the brain look like behavior. So there's two parts of the brain that we deal with in addiction. There are lots of parts of the brain, but specifically for addiction, there are two parts, and that's what I'm going to talk about. The first part is the frontal cortex. That is the part that makes you you. That is the part of your brain where you think and feel. That's where your willpower, your choice, your spirituality, your values, your morals, your ethics, your ability to rationalize and justify. That's your frontal cortex. It's conscious. You know what's going on. You can direct your thinking. That's what the frontal cortex is. Now, I use pictures sometimes to make things simple for me. So Superman is the frontal cortex, because when it's fully functioning, it has awesome superpowers. We have this amazing ability to think and do things, right? So fully functioning Superman equals fully functioning frontal cortex. Kryptonite Superman equals a frontal cortex that's not functioning optimally. The other part of the brain that we deal with is the midbrain. It's deeper inside, and it's an old part of the brain that even reptiles have. It's the part of the brain that is completely subconscious. We cannot control it or change it or fix it or make it think. It is at the level of the subconscious, and it has one function: keep you alive. That's it. That's all it was meant to do. So the midbrain's function is simply a survival relay station. It doesn't plan, it doesn't have like a goal for the future. It's right now, do I need to do something to survive or not? When it's active, when it feels like you have to do something to survive, it's an angry tiger. When right now, everybody's in this room not feeling threatened, I hope, you're a sleepy tiger. The midbrain's quiet. So the midbrain's primary function is to eat food, drink water, procreate, and kill off any predators or run away from any predators. That's it. That's all it does. It directs you to do these things in order to survive. When a baby is born, one of the first things we do is we feed it. Why? Because when we feed it, it releases a chemical, a happy chemical called dopamine into the midbrain, and the midbrain says, yes, we love that, we need that to survive. So essentially, we become addicted to food at birth because we need the nutrients. Drugs of abuse work in the midbrain. And when I say drugs for all purposes in this lecture, I also mean alcohol, because there is no difference between alcohol and any drug, and I will explain why that is, okay? But drugs that people abuse and become addicted to work in the midbrain. They don't work in the frontal cortex. We know this because in the 70s, we thought they worked in the frontal cortex because addicts look like bad people, right? We thought it was a bad behavior disease. So what they did was they put these little probes into mice brains, into the frontal cortex, and they let the mice self-administer cocaine. And what they found was that the mice didn't want the cocaine. They could care less about your stupid cocaine. They wanted to play and be mice and eat and do what mice do. But mice brains are very small. So when they pushed that probe a little bit further into the midbrain, what they found was the mice would now hit that lever and administer cocaine to the point of death. They wouldn't play or eat or drink or sleep or do anything else that mice are supposed to do. They simply administered cocaine. So mice get physically addicted to drugs, but mice don't come from bad homes. Mice are not uneducated. Mice, don't have brains or don't believe in different cause. I mean, it's all irrelevant because all of that stuff is frontal cortex stuff. So mice get addicted because the midbrain gets addicted. So what happens with repeated use of a substance over and over and over, or multiple substances that release this happy chemical into the midbrain, what happens is this neurological change occurs. Something actually happens in the midbrain, biologically changing it. So now it believes we need this drug just to live. It now becomes the most important mode of survival for the midbrain. It's a mistake, we know it, but it's a rewiring, and it's not changeable. So the example I use for people who are non-addicts, if you were in the desert and you were dying of thirst, you were on day 5 or 6, you hadn't had any water, your organs are failing, you're literally about to die, and I hand you a bottle of water, and I say, if you drink this, I'm going to take your kids, and your job, and your house, and anything that means anything to you. There is not a person in this room who is biologically capable of refusing the water. You can't. There's always someone macho in the audience that thinks, yeah, I wouldn't take the water, but you would. Because your frontal cortex is where you value your children and your job and your house and your spouse. And that, during times of survival, is completely shut down. It's not even working. So you can't even pull the value for those things. You simply need to survive. So you drink the water, your tiger will become sleepy because it's satiated, you're now no longer in danger. And your frontal cortex will come back online and you'll remember how much you love the things that you just gave up. So what do? You start trying to think of ways to manipulate and lie and cheat and get stuff back from me. Sound familiar? So in addiction, this line is crossed, and this line is this biological change in the midbrain. And this slide, and the reason I even mention this is because people need to understand this. In order to be addicted, number one, you have to have a gene for addiction. Most people do. There are a few people that don't, but if you don't have a gene for addiction, you'll never become addicted. That change in your midbrain will never occur. Okay? So, if you have the gene is activated usually by a specific drug. So, we all know somebody, and I call him Uncle Marty. He comes to Thanksgiving dinner and he says, I use crystal meth every day for 10 years and I just put it down and walked away and never used it again. All you need is willpower. Everybody knows that guy. I know that guy. He makes my life miserable. Because that's what every addict wants. Every addict wants to believe that they could just put it down and walk away. Now, what I know today is two things. One, either Uncle Marty was using crystal meth, which wasn't the drug that was going to turn on his addiction gene, and perhaps he's drinking alcohol every day now. Maybe he replaced one drug for another. Or he didn't have the gene for addiction. But either way, the midbrain change didn't occur in him. And we know it didn't occur because he was able to put it down and walk away and never use again. Okay, by definition, if you can walk away, you're not addicted. So if we were to take Uncle Marty, and we were to take someone who we know is an addict, and we put them in a brain scanner, and we do something called a PET scan, which shows the areas of your brain lighting up as they're working, and we were to show them their drugs of choice, Uncle Marty's frontal cortex would light up because he's thinking about the drug. He's thinking, oh my God, that stuff's awesome, I love it, or he's thinking, oh my God, that stuff's terrible, it ruined my life. But he's thinking about it. In a true addict, their frontal cortex is totally dark in the PET scan, and their midbrain is lit up because the midbrain is seeing that as a survival mechanism. Oh yeah, I need that. So they're two totally different parts of the brain. So addiction is basically this broken pleasure system. We call it a dysfunctional hedonic system, which is just fancy for broken pleasure system. Okay, so here's a brief, as simple as I can make it, this is how your brain works. You receive a signal. It can be from the environment, it can be an electrical signal, it can be a chemical signal. It binds to neuron A. Neuron A has receptors for whatever the signal is. Neuron A gets bound with whatever that is, and it releases a chemical into that space. That space is called the synapse. It releases a chemical into the synapse. The chemical that it releases is a neurotransmitter, which is something your brain makes. It's not from the environment. Your brain is making it right now. It releases a neurotransmitter into that space. The neurotransmitter then binds to the second neuron, and it exerts its effect. So, if I see a hole in the ground, I receive a signal through my eyeballs, that would be an electrical signal. It binds to that first neuron and says, hey, there's a hole. That neuron dumps the chemical into there, let's say acetylcholine, and the acetylcholine then binds to the next neuron and says, move your foot, pick up your leg, and then I step over the hole. Okay, that's very, very simple. But that's essentially how it works. So, when we use drugs, the drugs come in to the bloodstream, and they get into the brain, and they bind to neuron A. So neuron A has a receptor for opiates, and alcohol, and marijuana, and benzodiazepines, and barbiturates, and crack cocaine, and methamphetamine, all of them, has those receptors. The drug that you use comes in, it binds there, and then it dumps a neurochemical into that synapse called dopamine. Massive quantities of dopamine. Just tons and tons and tons. The dopamine then binds to neuron C here, and then neuron C sends a signal to your cortex that says, yes, that was awesome. That's what it does. So, if we were to cut off that synapse, if there was no dopamine allowed to get to neuron C, nobody would ever get high, nobody would ever experience anything from drugs and alcohol. So what does that tell us? That tells us that it is the dopamine that causes the response. We are not addicted to drugs, we are addicted to dopamine. Dopamine causes the reaction. And without it, there'd be no reason to continue. There'd be no reward cycle, right? So it doesn't matter if alcohol is bound on A. The dopamine that's released and bound on C is exactly the same, no matter what you use. That's why I say we can't focus on a specific drug, because they're all the same. Once this change has occurred, once this membrane is broken, it's all the same. So a heroin addict can put down his heroin, but if he's drinking alcohol and smoking pot, he's still releasing massive amounts of dopamine. The brain doesn't know the difference. Frontal cortex knows. Oh yeah, I know I smoked pot versus I shot heroin. But the brain doesn't, and that's where the disease is. And we're sending it the signal saying, it's okay to keep using. So in the brain we have 10 perceptual systems. Most people know the first 5, sight, hearing, taste, touch, sound, right? And then we have these other systems which are a little less well known, but they are perceptual systems. So this is why if you're driving down the road at 80 miles an hour, 65 miles an hour, you don't see the road whizzing by you and have no idea what's going on. Because your eyes are able to adjust in space and time and speed, and you can drive safely. Right, so that's one of our perceptual systems. If you are brave enough to wander down into your basement late at night with no lights on, and you can find the steps with your feet, that's a perceptual system. One of the perceptual systems that everybody ignores is a pleasure system. We all have a pleasure system. That's where that baby that's born that we feed, that's where that comes into play. We need pleasure to survive. If you never experienced any joy or pleasure from life, you have no reason to continue wanting to live. Pleasure is absolutely essential for living. So dopamine is the pleasure chemical. Dopamine is the chemical that says, yes, this is what I want, this is how I want to live, this is what I want to do. And we release dopamine from normal pleasurable activities. So in the brain, just like in our bodies, we have a set point for pleasure. So everyone in this room has a set point for temperature. 97 degrees Fahrenheit, approximately. That's where your body is happiest. That's where your organs function. That's where your blood is happy. That's where everything is good. A bacteria comes in and introduces to your system, you get sick, you get a cold. Your body raises its set point to 101 degrees. And it makes your temperature 101 degrees because it knows that it's going to kill off that bacteria at that temperature. Once the bacteria is gone, your body resets back where it's happy at 97 degrees Fahrenheit. That's how homeostasis works, right? Everybody here, that's how your body works. Well, we have a set point for pleasure in the midbrain. We have a level of dopamine that has to be released in order for us to say, yes, this is good. Now, my walking back and forth in front of a big audience may release some dopamine for me, but probably not enough for me to be like, I need to do that every single day. If you go on family vacation, if you like your family, and you go somewhere good, you'll release enough dopamine to cross that threshold. So much so that the next year you decide to go to the same place. And on the 3rd year, you start getting excited just driving there. And on the 4th year, you're excited just packing. And on the 5th year, booking your plane tickets or buying your tickets in advance, you're getting a little rush of dopamine. Just because it crossed the threshold, you remembered how awesome it is, and your brain wants to do it again. Getting a promotion at work, your kid gets on the honor roll. Okay, these are normal things that cross our dopamine threshold and say, yes, this is awesome, life is good. Okay? Drugs release huge amounts of dopamine, way more than any normal activity. Okay, and what I don't have in here that I should mention though is your process addictions, things like sex and pornography, shopping, gambling. They all release higher than the green line, but lower than the red line. So they release a lot of dopamine, not quite as much as drugs, but a lot, enough to become addicted on the red line. So all this dopamine is just being dumped in the brain over and over and over and over. So what happens is the brain says, okay, this is way too much dopamine. We're spending way too much time in this crazy pleasure zone. We're not even able relatively to experience pleasure anymore because we just have so much of this dopamine. So I'm going to take away some of these receptors for the dopamine. We don't need them because there's all this dopamine floating around. And it pulls away those receptors, but what that does is it moves our set point. It moves the set point up. So now, old pleasures, things we used to enjoy, no, they still release the same amount of dopamine as they ever did. But but it's not enough to cross our threshold anymore. Anybody know an addict who used to love to play the guitar, hang out with his family, do things, right? And since they've been using, they just don't have any interest anymore? Well, that's because neurologically they don't have any interest anymore. They can't get pleasure from things they used to get pleasure from. Stress is a huge player in addiction, and I talk about it because the American Board of Addiction Medicine and all of the studies in addiction medicine right now are really focused on stress. And the reason is because chronic severe stress releases a chemical called corticotropin releasing factor, which is on the test, so take notes. So when we have high levels of this CRF, dopamine, the response of the body is to pull away dopamine receptors. That's how all of us function, right? So we have high levels of stress, the brain starts killing off dopamine receptors. And what does killing off dopamine receptors do? Moves that threshold up, just like repeated drug use. So now you need more dopamine to experience the same amount of pleasure. So people who are very, very chronically stressed are already in the same kind of process of an addict. Now let's look at that in perspective. If you're an addict, how stressful is your life? Pretty stressful. Constantly looking for drugs, trying to find money, stealing from people, lying to people, trying to keep your story straight. It's a very stressful existence. And constantly worrying about the bad choices you know you're making and hurting people, right? So you're just exacerbating the stress by using, and both the using and the stress do the same exact thing in the brain. So it becomes a vicious cycle. This is also why people with very high stress lives that suddenly find that drinking a cold beer at the end of the day is the best way to relieve stress are at much higher risk to becoming addicted to something. If you have a very high stress life and you're go and crazy all the time, and then you fracture your finger and the doctor gives you 900 Percocet for some reason I can't figure out, and you take one or two of them and you realize, man, this Percocet helps my finger, but you know what it really helps? It helps me relax. Well, now we've just started the process in the brain. So high stress does the same exact thing as repeated drug use. So the two of them are like best buddies. Keep going. So basically, we get this pleasure deafness. So addiction is this stress-induced hedonic dysregulation. That sounds fancy, and that's so that I can convince the other doctors that it's a real thing. But really, it's just pleasure deafness. There's another neurochemical, well, there's a lot of neurochemicals involved in addiction. I simplify it because I think this is all that's really important for understanding. But there's two neurochemicals that I talk about in addiction. The first is dopamine. That's the big player. That's like the mob boss. Glutamate is really important though. Glutamate is the most abundant neurochemical in your brain. You have more of it than any other neurochemical, and what it does is it lays down memory. It lays down memory in association with high-level dopamine, with pleasure. So when I experience something good, like my family vacation, not only do I release dopamine, but glutamate lays down memory of how much dopamine was released, which is why I said next year driving on vacation, because glutamate comes in and says, hey, we're on that road that takes us to that place that gives us a lot of dopamine. That's awesome, right? So glutamate lays down memory of pleasurable experiences. Well, this is very problematic when you consider that most people go to the same bar to drink every day, hang out with the same people every day when they use, go to the same dealer, same house, same street, same town. This glutamate is the reason why in every treatment center across America worth its salt, we say you need to stay away from people, places, and things. That's not just, we're like, oh, they're bad influence. No, there's a neurological basis for that recommendation. Because your glutamate will not allow you to forget how awesome being with that person or being in that place was. We lay down that memory. What glutamate does not do is lay down the memory of negative experiences or experiences associated with no dopamine, which is why an opiate addict, an alcoholic, who are in detox, going through the worst detox of their lives, feel like they're dying, sweating, kicking, horrible, and your family heart is breaking watching this, and they get out after 5 or 6 days and they're clean, and then they go use again. And you're like, what? You just went through the worst thing I ever saw you go through, and now you're going to do this again? Yes, because glutamate does not allow the memory formation. It's not that they can't remember it. Intellectually, we can remember it, but emotionally, we don't have a connection to negative memories. If you don't believe me, is there any woman in here who has more than one child? Yeah. Childbirth is not a pleasant experience. And fortunately for mankind, we don't remember it as it is, because glutamate doesn't lay down that memory. And so, but then when you hold a newborn baby in your arms, you get tons of dopamine, oxytocin, all of that. You're like, yeah, I'm gonna do this again. 5 minutes after you just had the worst 20 hours of your life. So, let's talk about relapse, because relapse is often part of the process. So there are 3 things we know that evoke relapse in humans. 1, exposure to dopamine in high levels, okay? And this is where we run into a lot of problems, because this is where, number 1, every addict who's addicted to a specific substance or thinks they're addicted to a specific substance wants to believe they can still use some other substance. So you have your heroin addicts, your crack addicts, your methamphetamine addicts who put away the drug and then start drinking, and they think that's okay because I don't have a problem with alcohol, right? But alcohol releases huge amounts of dopamine in the midbrain, and so the chances of them relapsing on their original drug of choice, very high. The chances of them becoming addicted to that new drug, very high. It's a very, very risky place to be. And this also happens, and let's be honest. I'm not going to blame doctors for all of the problems we have. I certainly admit that not me, but other doctors have contributed to the problem. But doctors are not educated about addiction. This lecture that I'm giving you right now is the same one I give to all of the physicians at the hospital and medical students and residents. There's nothing different, okay? Because we don't even get this. We get nothing. And so they don't understand it. And so when you walk into an ER and you say, I'm addicted to heroin, I'm having a panic attack, they may know not to give you Dilaudid, but they sure as heck are going to give you some Ativan. And that releases huge amounts of dopamine. And then the addicts can't figure out why for 2 weeks after that ER, because they're restless, irritable, and discontent. Miserable, cranky. Oh, this is stupid, I might as well not even say it. I don't even know why I'm upset. Because that threshold starts moving again. As soon as you get exposed to high-level dopamine, you start that over again. And, marijuana, I'm sorry for those of you that are huge proponents of it. If you're not an addict, do what you gotta do with marijuana. But if you're an addict, it's off the table. Marijuana releases dopamine in the midbrain, sorry. So it does move the threshold and put you at risk. And I see this a lot, and this creates problems for me because of families. Because parents who see their kids using heroin get terrified and scared, oh my God, I don't want my kid to use heroin. And the kid puts down the needle, puts down the opiates, but then is smoking pot and drinking. And mom and dad say, well, at least he's not shooting heroin. We were going to kick him out if he kept using opiates, but if he's just drinking, at least he's safe. And that's a problem, because neurologically there's no difference. The second thing that causes relapse, stress. Anybody know an addict that relapsed? What do they tell you? My dog died, lost my job, wife left, bored, right? Stress, something stressful. And the third thing would be exposure to drug cues, which is our triggers, our people, places, and things. I can't tell you how many times addicts tell me, they come in and tell me, I was driving down the road where I used to cough all the time. I'll tell you what, man, I got knots in my stomach, I got sweaty, like, I almost felt high. Euphoric recall, that's what we call it. That's dopamine released in response to glutamate reminding you how awesome something was. Okay, so the midbrain now believes it needs high-level dopamine to survive, just to survive. That's what it believes. It's wrong, but it believes that. Okay, so we have this neurological change that says, I need dopamine to survive. So how does it motivate an otherwise normal, healthy, ethical, moral person? Because most addicts I know are really good people, or at least they were before they started using, so they're still good people. How does it motivate the soccer mom, the prom queen, the captain of the football team to go out and do these things that are counterproductive to their value system? I have parents all the time say to me, he was not raised this way. I don't understand where this behavior is coming from. So how? Where is it coming from? Craving. Now, craving is not like for the month, and I'm hormonal, and I want chocolate. That's not true craving, okay? True craving is an actual physiological event where the midbrain is awake and believes that it needs to survive. And you get physical symptoms, you can get sweats and chills, you can get nausea, but the primary symptom of craving is something called obsession. True and complete obsession. It's a tunnel vision. I cannot physically focus on anything else except getting what I need right now. And right now what I need is to feel different. That's it. That's all that addict is able to reconcile. The midbrain is saying feeling different equals survival. But the frontal cortex, the thinking part of our brain, is going, I just need to feel different. I hear what you're saying, I know what you're saying, I know you're right, but it doesn't matter because right now this is all I can focus on. And that's when we get that really anxious, antsy, like, okay, I hear you, but you don't understand. And then it's like these crazy rationalizations all over the place, right? That's true craving. This is suffering. This is ultimate suffering. To be able to be in a position to know that you can hurt your children or your parents or your spouse if you do this one thing, but you cannot do anything else. Your brain will not let you focus on anything else. That is craving, that is suffering, and that is how people get motivated to do the things they wouldn't normally do. This is also the reason the choice argument fails. The choice argument has been presented to addiction specialists all over, and it says, if you take a glass of alcohol and put it in front of an alcoholic or a heroin syringe and put it in front of a heroin addict, and you say, if you use that, I will shoot you in the head, the addict or alcoholic will not take the substance. And they say, see, they clearly have a choice. Well, the midbrain is able to differentiate the level of threat between a gun to the head and not getting the drug. And in that moment, the gun is a little bit more of a threat to survival. So the midbrain can prioritize. But what this doesn't take into account is the way this addict or alcoholic is going to feel for the next day, 2 days, 2 weeks, 3 weeks, 2 months. The irritability, the tunnel vision, the obsession at having seen that drug and not been able to use it. Okay, that's craving. So, craving has set in. So we know we need high level dopamine to survive, and we motivate the individual by inducing these cravings. So now, how does it control the behavior? I have this craving, I have this tunnel vision. How does the behavior get controlled? And this is where it gets fascinating. So, when you're craving, you have an angry tiger, an active midbrain, and your frontal cortex, which is the part that thinks and reasons and rationalizes and values, shuts down. It's quiet. So your frontal cortex is a library. It's a library full of information about you. Everything about your entire life is contained in that library. And now it's closed. Quiet, nobody's in there, lights down. And the midbrain, which is an awake, angry tiger right now, needs to get what it needs, sneaks into that library with a little sneaky ninja, and it starts going through all of your files. And it starts pulling out stuff that it thinks it could use. What can I use? What can I use? Pain. Pain. 10 years ago, we had a herniated disc, and that was really painful. That's why I got on opiates in the first place. And you know what? I don't really feel like that's been addressed properly. Nobody is addressing my pain. And I think that my pain is probably worse than most other people's because they seem to stay clean, and I can't because I have this terrible pain, right? Anxiety. Well, I had anxiety when I was a kid, so my anxiety is really bad. In fact, I feel like I'm having a panic attack right now. My anxiety is worse than anybody, and nobody understands. Or stress. I have terrible stress in my life, or whatever. So it will seek out the thing that it thinks will convince you that it's okay to use, and then use it against you. So now we have a reason to use, right? So to Uncle Marty, who says you just need willpower. Let me tell you how willpower works. If I'm at a red light, it's red, I can't go. My willpower keeps me from just driving through that light. That's what willpower does. It says, I know I can't go and I'm choosing not to. When the light turns green, I can go. It doesn't matter how much willpower I have permission. So that's what happens here. All the willpower in the world can't keep you from using once you've given yourself a green light. Once your brain has said it's okay because you have this problem, we can now do whatever we want. And this is where all of the lie, I have to lie to my parents because they don't understand. I have to lie, I have to go to 57 different doctors because nobody's treating my pain because they just treat me like an addict, right? And that's where all of these bad behaviors start coming in. Because we have this reason, this justification. And it doesn't have to be pain or anxiety, it could be death of a loved one, or a trauma as a child or as an adult, right? But that midbrain sneaks in and finds that little piece to throw against the wall and say, that's gonna stick, that's gonna give you a reason to use. And then once these behaviors start coming into play, once we start engaging in these behaviors, the behaviors themselves become part of the disease process. So, the need for instant gratification. Once you use high-level dopamine to cope with, Tuesday, nothing is going to compare when something really stressful happens. So, our brain gets trained to believe that the only way to solve the problem is instantly. And if it takes work or behavioral analysis, it's never going to work. I just need something right now. And so the ability to wait for gratification becomes faulty. And that's a part of the frontal cortex. So the frontal cortex is now starting to deteriorate. It's not working properly. Needing a pill or a chemical for everything. Now, I'm going to partially blame society for this because you turn on the TV and every other commercial is for some stupid pill that's going to fix one problem and cause 57 other ones. But that's what we promote. We promote, you got a problem, we got a pill to fix it, because we are too busy of a nation to have to worry about waiting out a cold. God, no, you need to fix that right now. And that's what starts happening. And for an addict, this is very dangerous thinking, because all it does is reinforce that need to constantly feel different. And so I use the example of over-the-counter sleep medications. Is Benadryl really addictive? It doesn't get in the midbrain, it doesn't release a ton of dopamine? No. People become dependent on the behavior. I need something to sleep. Let me tell you something. There's a disease called something complicated, like polyfamilial insomnial disease or something like that. There's 11 people in the world that have it. Nobody here has it. Your bodies were designed to sleep. So for some people, like myself, if you say sleep, I'm out, and no problem. For other people, it's a struggle. I understand that. But there's a list of 17 things behaviorally you can do every single day for a period of 2 weeks that will put you to sleep, that will put you into a cycle where you can sleep. But it requires a lot of behavioral modification. And why would you possibly want to do anything that required work on your part when you can just take a pill and fix it? Right? So for addicts, it's really important to shy away from these instant cures of any kind. Now, I'm not talking about you have a headache with Tylenol once in a while. I'm not talking about you have a cold and you need an antibiotic, okay? These are not things that cross into the brain. These are not things you're getting any reward from. I don't take an antibiotic for my cold and instantly feel better. I have to take it for a few days or a few weeks, right? So that's okay. But I'm talking about instant gratification. And then, my favorite addictive behavior that becomes part of the disease is looking for ways to avoid recovery-related things. These are my friends that come to my office and tell me I'm not going to meetings, I'm not going to group therapy. I hate people. I don't believe in God. Every time I go around other addicts, all I talk about is using. I'm going to find every excuse under the planet to not have to engage in the one thing you're telling me is going to work because it's counterintuitive to my disease. And my disease is running the show right now. And then if you have an enabling family member that's like, oh man, my baby doesn't like that. Right? And this is the reason punishment doesn't work. Punishment makes addicts really, really sneaky. That's all it does. Okay? Punishing someone, now, I'm not saying if you steal or hurt someone, you shouldn't be punished for that action. I do believe there are consequences for all our actions. However, being punished simply for being an addict or engaging in an activity related to your using, I don't really think there's benefit to that. Because essentially, being put in prison is not scarier to the midbrain than not getting the drug. And this is why we see people come out of prison after 5 and 10 years and pick up right away. Oh, I don't get that. Well, because nobody addressed the problem. Nobody addressed the problem. They were away and abstinent for all that time, but nobody addressed the problem, which was the broken frontal cortex and the angry midbrain. So during this craving, during this time of need, the frontal cortex is shut down, it's broken, it's not working. So the question becomes, how do we fix it? What do we do? So, the answer is twofold. We have a hierarchy of treatment, okay? So first and foremost, we have to treat the most acute problem first. So if somebody comes to the hospital and they're having a heart attack, they have to have morphine. That's the medical standard, okay? So there are certain things that have to be there first. So we treat the most acute problem first. Then once that problem is stabilized, we move to the next most acute problem. And we keep going until we've worked out most of the problems we need to work out. Well, in 90% of the cases, that's a lot, in 99% of the cases, addiction is the next most acute problem. So once we've stabilized their breathing and their heart rate and you're not going to die, okay, the next most acute problem is not their diabetes, unless of course their sugars are 900, but it's not the diabetes, it's not their cholesterol, it's addiction. If we do not look at this, then all the rest becomes irrelevant. Because I don't know very many addicts who are really diligent about checking their blood sugars when they're actively using it. So, we have to look at the actual medical condition. And addicts do, and I joke a little bit about pain and stuff. Addicts have real pain, there's no question about that. But opiates make pain worse, we know that. But nobody ever wants to look at that, right? That's a whole process. But it's a process that's true, and we know opiates make pain worse. So, they have pain and it should be addressed, but not in the way you want. That's what it comes down to. I do take your pain seriously, I do want to help with your pain, but that doesn't mean I'm going to give you what you want, because I know the part of your brain that wants that isn't working right. So we've addressed the injury, now we have to look at the addiction, right? That's the next most acute. So what's going on with the addiction? Well, first we have to look at detox. Right? Detox is not treatment. If I ask somebody, have you ever been in treatment, and they say, oh yeah, I came to St. Thomas for detox, that is not treatment. Detox is medical stabilization. That's it. The purpose is to give you a safe place where the substance can be taken out of your system over time, where you can be observed medically. Because if you're coming off of alcohol, or you're coming off of benzos, and for those of you that don't know what benzos are, Xanax, Ativan, Valium, Klonopin, they are freeze-dried alcohol. That's all they are. They are chemically identical to alcohol. People have DTs and seizures coming off of them just like alcohol. Okay? So, coming off of benzos or coming off of alcohol is actually a medical emergency because people die. So that has to be done under careful supervision. Handing someone a prescription for Librium is not going to get them safely off alcohol. Oh, okay, go ahead. You guys don't need all these drugs. Opiates. Opiate detox does not kill you. It is not lethal, okay, which is why we have so many problems for years getting reimbursement. If you had opiate addiction, you tried to come to the hospital and they said, no, you can't, we don't treat that. It's because opiate withdrawal is not lethal. However, if you do not treat your opiate withdrawal and you try to do it on your own, you make it to day 2, day 3, and say, I can't do this because day 2 and day 3 is a nightmare. You're going to go out and you're going to use, and you're going to use probably the same amount you were using 2 or 3 days ago, overdose, and die. So, while opiate withdrawal itself is not fatal, opiate withdrawal as a process can be fatal. Okay. Uh-oh. Fortunately for you guys, I can do this right off my head. No, go ahead. Okay, so, all right, so we're through detox. So now we move to the most important part of treatment, which is the actual treatment part. So what we need to do in treatment is twofold. We have to address the midbrain and we have to address the frontal cortex. So let's talk about the frontal cortex. How do we address it? We need to strengthen it. We need to get it back online. We need to remind it how to cope with stress. We need to remind it that there are places that are safe. We need to help these people develop new coping skills, because the only coping skill an addict has is to use. That's it. They've forgotten everything. okay? So we need to reintegrate those. We need to create an environment for spiritual growth. I mean personal, psychic, internal growth, whatever you want to call it. I'm not talking about religion, I am talking about spirituality. Spirituality is in the frontal cortex, not even close to the place where religion occurs, okay? They're not even related. I mean, we relate them often, but in the brain they're not. So spirituality is an interesting part of the brain, because what we know about it, it is the only part of the frontal cortex that is capable of becoming strong enough to overpower a midbrain. That's it, it's the only part. So think of it this way. If I go to the gym, let's pretend I go to the gym, and I'm working out my triceps, back of my arm, every day, constantly, and I'm never focusing on my biceps, eventually my arm is going to be stuck straight, like this, okay? Not functional. Think of the midbrain as the tricep, and it's always working out. It's constantly working itself out. I have to take action to work the bicep, so there's a balance. And eventually, my bicep can get strong enough to hold my arm from going straight again. That's what needs to occur with treatment. The idea is that the tricep, the midbrain, is constantly working. And we have to learn how to balance it. We need to bring the frontal cortex back online. So spirituality is actually the easiest and quickest way to do that. Now, that threshold we talked about with the dopamine, bringing that back down to normal is the quieting of the tiger, right? It's slowing down the midbrain. So we want that to come back to normal. There's two things that will do that. One, abstinence and time, and two, medications. Some medications will help bring that back down, but that's a whole different talk, okay? But it's helpful. So the idea is with abstinence and time, that threshold will come back to normal. But you ever heard the expression, once a cucumber's a pickle, it can't ever go back? If you've ever known anybody who was alcoholic and they drank for 25 years and nothing was wrong with their liver, and then suddenly one day they go to the hospital and their liver enzymes are through the roof, and then they stay off alcohol for a couple of weeks and their liver enzymes go back to normal, and then they drink one time and their liver enzymes go right back up. So it took 20 years for that first occurrence, but it only took one drink for the second, and it gets worse every time. The same thing happens in the midbrain. So that threshold may take 200,000 uses of a drug or alcohol to move up. It may only need one. We don't know, and it varies for everybody. But that threshold moves up, it's now broken. So even with time and abstinence, it comes back to normal, but with one use, with one shot of Ativan, with one shot of Dilaudid, with one drink of alcohol, it starts moving right back up again. So you may have worked for 6, 8, 9, 10 months getting that threshold down, and it just takes one time for it to start moving back up. And what happens is in that time between when it's too high for you to experience pleasure and when it's normal, you're miserable. People are miserable. So what we know is that engaging the spiritual part of the frontal cortex will bring that threshold down more quickly. It allows people to actually experience pleasure from normal amounts of dopamine more quickly than anything else. Doing nothing at all, lock yourself in a room I'm not going to use, could take up to a year for that to come down. Who wants to feel like that for a year? Nobody. I use. I wouldn't want to feel that miserable. And that's why people do relapse. You know, it could take even longer. But if we are engaging the frontal cortex and we are sort of developing that spiritual part of things, that psychic internal thing, whatever you want to call it, we will get a quicker return on the money, basically. So, oh, good, perfect. So, 80 years ago when Alcoholics Anonymous was founded, they didn't know all of this, obviously, neurologically. It just so happened to work out. The 12-step community is spiritual growth for dummies. That's all it is, the 12 steps. I'm not talking about the meetings and the sponsor and all that stuff's important because you can't work through the 12 steps without that stuff, but it's those 12 steps that are actually a step-by-step instruction manual for strengthening the spiritual part of your frontal cortex. That's what it is. Counseling is really important. Counseling is really important. Counseling, though, individual counseling has not been as effective as group counseling and 12-step communities. And the reason is, well, there's a couple reasons. One, because no matter how good of a counselor you are, no matter how long you've been in recovery yourself and really get the problem, you cannot out-manipulate an actively using addict. It's not possible. So one-on-one is not going to work. The other reason we know that it doesn't work that well is because that's what addicts want. That's what every addict, I just want to see a counselor, I just got to talk about my problem. No, because I don't need to know how to make a donut in order to eat a donut. I had a donut this morning, I don't know how you made it. I don't need to know why I'm an addict in order to fix it. I don't have to go, now going back into the trauma of my past and looking at all of those things is very important to therapeutically developing as a person. But as far as getting clean and sober, not necessary. The reason we encourage group therapy and fellowship is because other addicts have an amazing ability to see a broken frontal cortex. They have the ability to say, you are not thinking clearly. Your Superman is loaded with kryptonite right now. They can do that in a way that they can't do for themselves. Go ahead. So, over time, this spiritual growth, these coping skills, this behavioral development, the threshold starts to move back down. Okay, go ahead. So the idea of medication, so there are some medications. Now, I'm a chemical dependency physician. I will never stand in front of a room of people and say a chemical is the solution to a chemical problem. That doesn't even make sense. Okay? If that were true, there would be one pill to rule them all. It would be the precious, and it would block all of the receptors. Okay? It doesn't exist. So we have turned now to using some medications, partly because that's what our society dictates, but also because we know that it has a really important role in quieting the angry tiger. Go ahead. I think. So the role of medication is to quiet the angry tiger while Superman is very weak. So let's look at our current problem. Let's look at our opiate epidemic and who it's affecting. A lot of really young people, right? 80 years ago, when Alcoholics Anonymous was founded, we had a bunch of mature gentlemen who had spent 20 and 30 years drinking and had lost their lives and their jobs and their careers, sometimes twice. And they were so desperate to get well that they would have done anything you asked them to. So walking into a room of a bunch of other alcoholics going, you need to find some kind of God and shut up and listen. They're like, okay, I'll do whatever you say. Right? That level of desperation is necessary. Today, because we know opiates cause this change in the midbrain so much more quickly. I always say that opiates and methamphetamine and cocaine, they're like the Maserati on the way to hell. And alcohol is like the Schwinn bicycle. So we're going to the same place, just one's going to get us there. So now we have all these young people who are 18 and 19 and 20 and sometimes even younger, who are using opiates, and this change in the midbrain is occurring, and they are losing their job at Taco Bell, and their parents aren't letting them use a car anymore, and man, this sucks. And that's the level of desperation they get to. So how do you get a 20-year-old who is already invincible, knows everything, doesn't believe in anything you tell them to believe, will not shut up and listen? How do you get them to engage in this frou-frou coping skill, spirituality nonsense? You gotta quiet their midbrain. You have to quiet the midbrain. Because they don't have the ability, they don't have the wisdom, and they don't have the life experience to be able to just work out their mindset. So there are some medications we use. Now obviously for alcohol, there are some medications we use to treat, to help. Now there's nothing that blocks alcohol, okay? So antabuse makes you violently ill if you come in contact with alcohol. But negative reinforcement has not been shown to have long-term effects. So as long as you're taking the drug, you probably won't drink alcohol and vomit a lot. But there's a good chance that as an alcoholic, you'll find out that Xanax does the same thing for you, and you'll just switch to that. Camprol and naltrexone reduce cravings. Now, in the medical world, when they look at studies, they look at something that's statistically significant. And so they found that with naltrexone and Campril, that if you drink 6 days a week and you take one of these medications, it reduces your drinking to 2 days a week. And that is a success. And we can put that drug on the market. In my world, drinking 2 days a week is exactly the same as drinking 6 days a week, because it's always going to lead to eventually drinking 7 days a week and wind up in the hospital. It's like trying to quit smoking by like having 2 cigarettes a day until something stressful happens, and then you have 4 cigarettes that day, and then 10 cigarettes the next day, and then you're a pack a day again, right? So, same idea. Now, for somebody who's abstinent from alcohol, I've been white knuckling it, I'm getting through it, I haven't drank in 2 weeks, but I really want to drink. Taking something like Campril or naltrexone will cut the cravings and will quiet that tiger a little bit and perhaps make it more manageable to get through the day. So they can be useful. Now, opiates, which is our problem child, we have a couple of options. My personal favorite option, naturally, is Vivitrol, because it is an injectable opiate blocker. So you inject it, it lasts 30 days. If you try to use an opiate, you cannot get high. It is a euphoria blocker. It binds to the opiate receptors on that neuron A, and if you try to use heroin or morphine or something, it comes in and it's like, nope, you're not getting in here. Totally blocks it, okay? And you're like, that sounds awesome, why don't we give that to everybody? I don't know, we should. No, the problem with that is obviously it doesn't block any other receptors. So the midbrain is still broken, and it still craves high levels of dopamine. And so without any other treatment, taking Vivitrol is simply going to help the addict move to a different drug, something that's not blocked. It's a very useful drug. It's a great safety net. I love it. I would use it in all my opiate addicts. But nobody gets a drug from me unless they're engaged in their bicep workout. If you are not working on that frontal cortex, it doesn't matter what drug I give you, it is not going to work for the long run. Then we look at, let's look at methadone. Been around since the 70s. Methadone was designed as a harm reduction medication, meaning you want to stop pushing your grandmother down the stairs and stealing her purse for drugs. We want you to stop doing that as well. Here's a drug that might help, okay? Its entire purpose was simply to saturate those receptors and release a large amount of dopamine slowly over time so that there wasn't the constant withdrawal and the constant waking up of the angry tiger, right? Giving a methadone keeps that tiger sleepy for 72 hours. And if you take it every day at 24 hours, you keep that tiger pretty sleepy. The problem again, though, is that the midbrain still thinks it needs high-level dopamine just to survive. So if all you're doing every day is taking a drug to satiate that tiger, and then someone dies, or something tragic happens, and you're not working on that frontal cortex, those coping skills, that spirituality, you are going to go use cocaine, or alcohol, or marijuana, or benzo, something, okay? Because methadone doesn't do anything to those receptors. Suboxone. Suboxone is a partial opiate. So let me explain something about Suboxone. The main ingredient in Suboxone is buprenorphine. Buprenorphine is an opiate and an anti-opiate. It's both. It does double duty. Suboxone also contains a medication called naloxone. Naloxone is very similar to Narcan and Vivitrol and naltrexone in that it completely blocks opiate receptors. However, naloxone, when taken sublingually, which is how you take Suboxone, is completely unavailable. Meaning if you take it under your tongue, the naloxone just gets pooped out. It doesn't even get to your brain. It doesn't do any blocking at all. What blocks is the buprenorphine itself. So the buprenorphine comes in and it binds to the opiate receptor and it releases a spring rain of dopamine. Not the tsunami that we're used to, but a spring rain. Enough to cut down on cravings, enough to prevent withdrawal, but not enough to be really high and gorked. But it also binds so strongly to those receptors that if you use heroin, morphine, or oxycodone, nope, not getting in here. That's the buprenorphine. So Subutex, which is just buprenorphine we use in pregnancy, and Suboxone are the exact same drug. Now, are buprenorphine and methadone drug replacements? Yes. Are we replacing replacing one with another? Yes. Are we cutting down on the consequences and the constant craving and overwhelming angry tiger? Yes. And is that sometimes necessary in order to be able to work on their frontal cortex? Yes, sometimes it is. Is it a crutch? Are these a crutch? I hear that all the time, it's just a crutch. Well, you know what? If I break my leg, I need a crutch. I gotta stay off that leg while it heals. I still gotta go to physical therapy. I still gotta go to aquatherapy. I still have to meet with my surgeon. I still have to do exercises at home. Those things still have to be done if I want my leg to heal. But in the meantime, I need to stay off of it, and I need a crutch. So, yes, it is a crutch. But that's what the purpose is. It's to take pressure off of the midbrain so that the frontal cortex has some time to develop. So, not everyone should be on these medications. I am not a proponent of every single opiate addict being on this on an individual basis, okay? But some people really do need this. And I'll tell you what, some people, they wind up on a crutch, they wind up in a wheelchair for life. Some people will need medication for life to keep that midbrain quiet. Most people, probably not, okay? But the idea is we have to work on the frontal cortex. And this is why these medications have such a bad name and quite frankly a bad reputation. One, because the doctors out there prescribing them are just doing it for cash. And two, because families don't see the change. They see a change, oh, he's not using, oh, he's not stealing, he's not lying. But there's other things going on. That frontal cortex is not being strengthened. It has to be strengthened. If we are not working on the frontal cortex, these drugs ultimately become useless. Which is what I just talked about, so go ahead. Okay, so the idea behind these is harm reduction, right? So let's talk about a diabetic. I have two newly diagnosed diabetics. You have diabetes, you have diabetes. Let's talk about how to test your blood sugar. Here's your test strips, here's insulin, this is how you use it, this is how you count your carbohydrates, watch what you eat. If you exercise and you eat fruits and vegetables, you're gonna do really well. I'll see you in 2 weeks. But if you get a sugar craving, here's some sugar-free candy. Person 2, you have diabetes, that sucks. Here's some sugar-free candy. See you in 2 weeks. In 2 weeks, both of those people are going to have slightly lower blood sugars than they did when they came in. But at the end of 2 weeks, when they run out of candy and they get a sugar craving, person A is going to call me and say, hey, I'm craving sugar and I think I should eat an apple because that's what the dietitian said, but I'm not sure. And, going to try and do the right thing. Person B is going to go, well, I've been eating the candy all week. I might as well just go get some more candy. And they're going to eat a Snickers bar and go into diabetic coma. Okay, that's harm reduction. It has a place. That sugar-free candy has a place. It just shouldn't be the sole treatment, and that's what the medication really is about. It shouldn't be the sole treatment, but it can be a really useful tool. So the definition of addiction. Addiction is the dysregulation of the midbrain pleasure system due to unmanaged stress, resulting in symptoms of decreased functioning. So the symptoms would be loss of control, acting like a fool. Persistent use despite adverse consequences. If there are no adverse consequences, there's no reason to stop. Let's be honest, right? Financial, medical, relationship, job, whatever. If there's even one consequence from your use, leave it. And you continue to use, we have persistent use despite negative consequences. And craving, which is a physiological, overwhelming tunnel vision, inability to think about anything but using. These are the symptoms. So we fit addiction into the disease model. The organ is the midbrain. The defect is this dysregulation of the pleasure system with dopamine. And the symptoms are loss of control, craving, persistent use despite negative consequences. Addiction is a disease. It is a neurological and psychiatric disease. And the ultimate toolbox is essentially a combination approach. Look at this person, look at their life, look at what they've done, and what is the most important thing right now to get this person well? Is it to quiet their tiger, or is it to strengthen their Superman? Because everyone's going to vary, and they both need both, but some have more of a priority for one or the other, which can be assessed. It can be assessed by a treatment provider. This person needs to have their coping skills really worked on. This person really needs to look at, their personal growth. This person really needs to get some medication because he can't even focus on anything I'm saying right now. So, addicts have real medical problems in addition to their addiction, and they do have to be addressed, but we have to do it in kind of a safe and aware way. Because I know lots of addicts who are in recovery who will come to the ER and say, I'm an addict in recovery. I do not want this, and when the doctor says I'm giving you this, they say, whoa, what is that? If I don't know, I'm going to Google it. I'm going to call somebody. I'm going to make sure nothing's getting into my system that can mess up my recovery. Addicts can take responsibility, okay? That's a big part of it. So not putting the blame everywhere else, once it's established that this disease is present, is really important, but treating the medical conditions is also really important. Not just blowing everything off, oh, she's just an addict who wants more drugs, okay? What is this really about? Is this really about a herniated disc, or is this really about an angry tiger right now? And my word about marijuana, I put up here because everybody has a question at the end. So, like I said earlier, marijuana, if you're not an addict, I don't care what you do. Do what you gotta do, right? You're gonna drink alcohol, fine. You wanna smoke marijuana, I don't care. My addicts, it's off the table. It is absolutely not an option because I know it releases dopamine in the midbrain, I know it moves that threshold up, and I know it puts them at risk for relapse back on the original drug of choice every single time. I've not ever seen it not work that way. So it is not an option. But I mean, they all come to me too, I can't wait till marijuana legal. Like, why? It's not for you. You can't have it. It's not going to be for you. You know, if you want to ask me, do I think that if it becomes medically available to people, would I prefer people be prescribed marijuana versus oxycodone? I'm going to say, yeah, probably I would. My opinion is that I probably would. But that's about as close to a real opinion about it as I have, because it doesn't impact my work. And it is a family disease. Why is it a family disease? Is it because your addict steals from you? Is it because your addict lies to you? No. It is because you focus on your addict the way your addict focuses on drugs, which makes your addict your drug of choice. You have the same disease as the addict. Same disease. It actually does occur in the midbrain. There is some small amount of dopamine release, not that you find pleasure in catching them doing something wrong, but the relief that comes with knowing that you're right. The relief that comes with saying, like, I know something's not right, and then you become like a probation officer, and you're like going through their like phone statements and their bank accounts, and you're sleeping with your pillow, with your keys and your debit card and your pillowcase, and you're like, yeah, I know it's not normal, but this is the way we have to live it, right? You became an addict. You are acting like an addict, doing things that don't make sense in order to protect and preserve your drug of choice. So that's why we send people to 12-step programs, families, Al-Anon, counseling. Because you need to strengthen the frontal cortex as a family member. Your frontal cortex is weakening too with every day that you focus on them. Your frontal cortex gets weaker. And you know, I always say that because the treatment is spiritual or psychic or whatever you want to call it, your addict is not going to want to do it. That's okay. That's part of the disease. And understanding that and saying, I understand, but this is what you need to do to get well, and this is what we're going to support. That is very important. Because I know just as many addicts who have died in their parents' houses as have died on the street. So, you know, I'm not saying you need to kick everybody out, you know, but there are some boundaries and some tough love things that people talk about. If you're going to treatment, you're hearing about it. Okay? And I always say that, you know, think of addiction, not your addict, but think of addiction as a terrorist. You don't negotiate with terrorists. So if an addict is actively using or actively in the place of this angry tiger, so maybe it's been 5 days or 6 days, maybe it's been 2 weeks or 30 days and you're having post-acute withdrawal, meaning the midbrain is like woke up for no reason. It's just part of the process of healing. And it's like, hey, I'm miserable, I want to feel different, my life sucks, and I need to fix it, and I'm going to go out, and you know something's wrong. You don't negotiate. No. This is the plan for treatment, and this is what we're going to follow. This is what we have to do. You want to get well, I want to help you. But what you want is probably not going to help you. I always say that. Tell me what you want to do. Well, I don't want to go to inpatient residential. Okay, well then that's probably the thing that's going to help you. That's probably what you need to do. Right? I can't go to residential, I have to work and take care of my kids. I understand that stuff's important, but anything you put ahead of your recovery, you lose when you relapse. And that has been proven over and over and over. So if you make your job or your family more important than going to group or therapy or meetings, when you relapse, not if, but when you relapse, Those are the things that you'll lose first, your job, your family, right? So you have to put recovery first. But if a patient says to me, I don't really want to go to inpatient, but I will go wherever you think I need to go, that patient I'm going to put in outpatient. That guy doesn't need to go to residential, because there's a willingness there. When the willingness is there, we know there's a level of desperation. We know that they might be able to get well with a lesser level of treatment. And the only people that really don't think 12-step meetings work are people that are still using. I mean, I see them in the hospital all the time. They're detoxing. Did you go to meetings? Yeah, that doesn't work. Well, obviously, neither is whatever you're doing. So maybe you try it. And 12, again, the 12-step, you know, and this is a statistical fact as far as I'm concerned. 12-step meetings, and I don't care which ones you go to, because the 12 steps are the 12 steps. You have Food Addicts Anonymous, Sex Addicts Anonymous, Cocaine Addicts Anonymous, they're all the same, doesn't matter, right? You're just an addict. So the 12 steps is 100% effective. It has a 100% success rate if you take 100% of the suggestions. That is a fact. Now, as a human, it's really hard to take 100% of any suggestions. And there's always going to be that one thing that you don't want to listen to. And generally, if you're able to do that one thing, that's kind of the turning point. That's the point where that spiritual growth really starts to occur, is to be able to say, okay, I'm going to admit right now, I don't know better. I don't want to do what you're telling me, but I will. So, and the truth is, you know, we're never going to treat this disease to extinction. It's just not going to happen. But we can focus on, we need to focus on is prevention. It's an adolescent disease. The American Board of Addiction Medicine says this is an adolescent disease. There's no question about that, okay? Because most people get their first taste of some kind of high-level dopamine in adolescence. How do we prevent it? I don't know. I don't have an answer. I hope you weren't coming here expecting me to have the answer to that question, because I don't. My thoughts are, you know, if you're teaching adults and young people these coping skills and this spiritual growth and this personal development as a treatment for addiction, maybe it's not such a bad idea to teach them those skills before they ever get introduced to anything ahead of time. I don't know if that would work, but we know the DARE program so far hasn't been super successful, so somebody's got to come up with something. Okay, so before we move on to questions, I'm just going to talk briefly about me. So you can, we're good with the PowerPoint. So people ask me all the time why I do this. Why do I treat addicts? Why do I want to work in addiction? And well, I mean, the truth for me and for a lot of addiction providers is I'm a recovering addict. So it's really hard to want to get into this field if you haven't been through it, because addicts are really annoying. So if God gives you a gift, you really should use it. And so I believe my addiction is a gift, right? Regardless of where it took me in the depths of it, it's a gift, because now I can use it hopefully to help somebody. So I was born in New Jersey, and I had a normal family. My parents were divorced when I was a baby, but they got along well, and they lived in the suburbs, and my mom was a single mom for a while, and my dad remarried, and we were like, happy, everything's good. I believe my addiction started long before I ever used drugs. In kindergarten, I learned that if I lied and said I didn't feel well, I got extra attention from the teacher. I learned that I got to come home early from school if I said I didn't feel well. I also learned that when my mother asked me if I was okay and I said yes, she didn't get upset. So I learned how to control her feelings. I learned how to control everyone's feelings by lying and manipulating. That was my first foray. That was my first character defect emerging at the tender age of 5. I was also really sensitive, like terribly sensitive. Like I would take all my toys out every Saturday morning and play with all of them because I didn't want any of them to feel bad. If my aunt from Arizona sent me like the world's ugliest sweater, I would wear it, but only because I didn't want the sweater or my aunt to feel bad. Right? I was just a really sensitive kid, and I didn't know how to deal with that. And, you know, while my parents were, I think, able to see that I was very sensitive, they just attributed it to, oh, she just has a tender heart, a sweet soul. And nobody ever really thought of it anything other than that, including myself. I mean, I didn't know any better. At some point in my early teenage years, I suffered some sexual abuse, which happens to 1 in 4, I think, women who are addicts, so nothing unusual there. But in my experience, there are 3 types of people that go through some kind of trauma when they're young. The people that deal with it. They go to therapy, they get angry, they feel what they gotta feel, they don't necessarily forgive and forget, but they move on. Those are the healthy people. Then we have the people that are victims. And for the rest of their lives, they're a victim. This happened to me, and therefore, screw the world. And then there are people who are the heroes, who say, so, it happened to me, but I'm fine. I'm fine, I'm strong, I can get through this, it's not a big deal. And that was me. And so my parents saw that and thought, she's okay. She said she's okay. She doesn't need to deal with anything. She's just going to move through. My daughter is so strong, right? And so then they feed my ego. She's strong. So now I know I have to continue to be strong and independent, and that's just how I have to be. The problem is, when you're being fed these kinds of things, which aren't necessarily true, you have no ability to build your own self. So I had no idea who I was. And they talk about a chameleon, that was me. I did very well in school, obviously. I got into medical school, so I did very well in high school. But chameleon doesn't even begin to touch the kind of person I was. Because I'm smart, I was able to meet somebody, and you could tell me about a band that you liked, and I would go home, and I would research that band, and I would listen to every single song ever written by them. And I would be able to just nonchalantly bring up some random B-side song by that band the next time we run out, so that you would know for sure that not only was I cool, I was cooler than you. And this was the days before Google, so you know I had work for that. I would go to the library. But that's how I was. It was all about, making you think a certain way about me, creating this picture that I wanted you to have. I heard someone at a lead once tell me, the worst prison I've ever been in is the one I created based on what I think you think of me. That's me. Terrifying. And so I spent my whole entire life building up this image of what I wanted you to see and not spending any time at all building up who I was. I always tell people when I got out of rehab, if you went through my music collection, you'd know everything about everyone I ever dated and nothing about me. I didn't even know what kind of music I liked. That was my addiction. So I started drinking, I think, at like 14, I don't even remember, because it's irrelevant from my story. I started drinking, I found that it made me feel different, I found that it made me not feel like I had to control everything in my world. I felt like I had a little bit of freedom and I wasn't so overburdened by worrying about what you thought and you thought and you thought. And then marijuana. And then, I'm in college. And of course, I went to Penn State. It's a drinking school with a football problem. I had to drink my body weight in alcohol just to graduate. That's what you do there. So but I always justified my use because I got good grades. I was doing well in school. I deliberately sought out friends that did not do well in school so that I could say, see, these people are the drug addicts. They have the problem. I don't. And I was certainly, I was a smart friend. And I was so smart that if you handed me a handful of pills, take them. Take them and see what they did later. And eventually I found my second drug of choice, which would be men, and dated someone who was an addict, didn't know anything about addiction. He introduced me to opiates, and at some point in college, that was where it took off. And it was not a very rapid progression to the point of using heroin. So, by the grace of God, and I say that ironically because at that time, I did not believe in any such thing as God. But by the grace of God, I did manage to get into medical school because you function the way that you live, right? So if I'm constantly studying while I'm on drugs, well then taking tests on drugs is not that hard because that's how I study. That's how my brain works. So I get into medical school and somehow managed to get all the way through my third year of medical school. Now if you read my reviews from my clinical rotations for the first 3 years of school, I wasn't doing as well as I thought. But at least in terms of appearance and presentation and hygiene. But I made it through the third year, and I basically scheduled all of my rotations at a hospital in Newark, New Jersey, because that's where my dealer lived. So I was living in the backseat of my car under a bypass in Newark, so that I could meet my dealer and then go right to the hospital for my rotations. I know, classy, right? So the day came, and and I tried everything. I need to stop, it's just physical, I'm just physically addicted. I hate this drug mentally, it's just a physical thing, I just gotta stop using. And I'm gonna draw like a pie chart on how we're gonna cut down, and have all kinds of plans that, lasted like 9 or 10 minutes. And then you just keep using it because it owns you. It just owns you. It owns every part of your mind. And I had no way out of it except to use. When I used, I got a moment of peace. And I could say, okay, I see how this is really screwing things up. So I need to come up with a plan before I get sick again, because I know I'm going to use when I'm sick again. And that's really what kept happening over and over and over. And one day I said to my boyfriend at the time, you know what, I should just stop medical school, quit, and just be a junkie for the rest of my life. And I was okay with that decision, which is odd, but I felt peaceful, like, okay, I don't have to focus on any, I can get rid of all these other stressors in my life and just focus on this one. And it was in that moment that if there is, at the time I didn't believe in God, but I do now, in God, if it was like surveying the earth with like a spotlight and heard me say that and was like, what? What? Who are you? Who are you? This is not who you are. This is not who you were meant to be. You were this girl with all these ambitions and things you wanted to do with your life, and you were going to achieve amazing things, and now you're going to give everything up to be a junkie, to be a statistic. And I felt that in the hole in my soul through which the cold north wind blows, which is what addiction is. It's a spiritual place of desperation. For me, it was a spiritual bottom, ironically, in a very non-spiritual person. So I walked in the next day to my rotation, and I went to the psychology counselor, and I pulled up my sleeves and showed her all my check marks and started crying. What happened after that is kind of a blur. I know that they put me in touch with medical boards who wanted me to do certain treatment, and like every good addict, no, I don't need that. I just need pizza. That's all I need is just pizza. I just gotta physically get off this stuff. Fortunately for me, there are people out there that know better. And I was in a position where if I did not do what they said, I could not finish school. And if I could not finish school, I had $175,000 in school debt and no way to pay back. So apparently that was enough for me at the moment. So I figured I'll do it something. So I went to treatment. And I did 72 days of residential treatment, which my insurance did not pay for, which I did not have the money for, which I'm still paying for. And when I got out, I had to jump through a bunch of hoops. I had to get urinals, I had to be monitored, I had to meet with therapists and go to group and do all the things they told me to do. And my addiction was still very active. My addiction was active in the form that suddenly I had the urge to shoplift all the time. I used to steal when I was using, but for necessities, right, like toothpaste and deodorant. But now I just wanted to steal. Where did that come from? The need for dopamine. I needed dopamine. I needed to feel different. And that was something I knew that would do it for me. Sex, gambling, shopping. Thank God I didn't have any money at the time. Or credit cards. I'd be in a lot of trouble now, right? Because I just wanted to do anything to feel different. And trust me when I tell you, I would salivate at the thought of drinking alcohol, but insist that I didn't have a problem with alcohol. Now, if you told me I had to give up broccoli to never ever use heroin again, great, no problem. Tell me I have to give up alcohol? Yeah, but I don't really have a problem with alcohol. By definition, if you do not have a problem with it, it shouldn't be a problem not to use it, right? But I did what I was told because I had to, and I felt like I had no choice. And so I would go to these stupid meetings, and I would listen to these stupid people talk, and I would think, I'm so much smarter than these people. And I would read their book, and I would come back in and I would regurgitate in a beautifully articulate way everything that they were saying, and they would say, oh, now she's really getting it. And once again, I'm doing the exact same thing in recovery that I was doing before I got clean, creating an image for you to see. Come to my house the first year of recovery, you'd see my bookshelves loaded with books about spirituality. I didn't read any of them. They were just on my shelf in case you came over and saw that I was really spiritual, right? And it wasn't until I was at a meeting and I ran into a woman who was very much like me when she shared. She was so incredibly honest and vulnerable, and I thought, wow, that seems like totally freeing, and that's what I want. And so I said, will you sponsor me? And she said yes, and I was totally upset with that decision for many, many months, but I am extremely grateful for it now. And she was able, as another addict, to look at me and say, you need to shut up in meetings. no speaking. 6 months, I don't even say a word in a meeting. And I said, "But I have such good things to say." And she said, "Trust me, they'll be all right. They'll be all right without all of your wisdom and insight." And I thought, okay. And so that put me in the position of sitting there and having to listen. Because I couldn't be formulating my response or what I was going to say or how I was going to make myself look good, right? I had nothing else to do but sit there and listen. And then I started hearing things that were making sense. And then she, took me through the 12 steps, like a sponsor's supposed to do. And she told me, no, you cannot go home with that guy tonight. You only have 6 months clean, and we know what you're looking for. So no. Okay, Mom. And it was that willingness on my part, and that truly is the only thing that I have done in my recovery. That is the only part of my recovery that I will take credit for, is that I have the willingness. I was willing to do what people asked of me and told me to do, even though it hurt my ego and it hurt my pride and it made me feel bad and it made me uncomfortable. But I was desperate enough, because during that year I was so miserable. Now today I know, because my dopamine threshold was so high, so no wonder it was so miserable. But at the time I didn't know, so I just thought, what's the point of being clean when life sucks like this? Until I started doing what I was told. And then my life started getting exponentially better. And in that first year of recovery, they tell you, write down a list of everything you want to do in your life in the next 5 years. Where do you want to be in 5 years? Write it down, put it in an envelope, sign across the seal, and put it away. If you get 5 years clean, open that up. Well, I'll tell you what, when I had 5 years clean, I opened that up and I laughed at myself. It was a joke. What I thought I could accomplish was a joke. I had accomplished in 5 years probably 10 times more than I thought I could. Just walking the walk, just doing what I do, And my life today is amazing, amazing. And it's 100% because I am in recovery. It is because I am an addict who is not actively using and who has found a solution for a broken frontal cortex. Most people go through life in a linear fashion of developing wisdom and experience. And then they're on their deathbed and they say, well, what do you want us to know that you're dying? And they say, well, be happy no matter what. Spend time with your family. Don't focus on work, right? They have like pearls of wisdom, right? But that's after a lifetime of experience. Well, as an addict, we're coasting along at this not quite steep of an angle, and then we bottom out because life is terrible. We're really bad at it. And then this catalyst comes, which is the addiction. And it lights and it shoots us up exponentially. And so at a much younger, earlier point in life, we get this gift of wisdom that many people don't get until they're ready to go. So you get this gift, and then the desire becomes to share that gift. Because you have no idea how amazing. Anybody in here that is new in recovery, I'm going to tell you what, if I would give up my husband, who I love dearly, my house, my job, my car, everything, my family, everything I own, I would give it all up to be able to give you one little piece of what's in my heart from recovery. I would. That's how powerful it is. That's how amazing it is. That's how much I know people can live and do well and exceed all the expectations if they just take direction. If they just accept I have an illness and it needs to be treated, and the way it needs to be treated is not the way that I want it to be treated. They can get well. And they also can die. I have a lot of friends that have died over the last almost 12 years now. I've been clean. A lot of friends. Family members, my first husband died of an overdose. I was still clean. He relapsed, wound up dying. I stayed clean. The stress no longer runs my life. Because dopamine no longer runs my life. Because the spiritual growth in my life is what runs my life. And again, I'm not a super religious person. It's just about what's in here and finding what's in here and making that more important than what's going on up here. That's what recovery is. So, people ask me to speak all the time to give hope. Is there hope? Of course there's hope. Yeah, there's hope. And I am not some kind of exception to the rule. I am not some kind of superhuman being. My husband thinks I am, but I am not superhuman at all. I'm just a normal person who got addicted, had her life really suck, made a decision, took some action, and it's gotten better. That's it. You know, the smarter you are, the harder it is to get clean, that's what they tell me. Because when that midbrain is tapping into your frontal cortex, right, it's using all your resources against you. So the smarter I am, the smarter my disease is. And the sneakier it is. So there are still days in my life that I go home from work and I think, I am 37. I am 37 years old. If I want to go home and get in my jacuzzi bathtub, which I have now, it's a big step up from the backseat of my car. And I want to drink a glass of wine to unwind from a really stressful day of dealing with really stressful people who make me want to beat my head against the wall. I should be able to have a glass of wine. And I don't. I don't. Obviously, I have almost 12 years clean. When I say clean, I mean clean. But here's what will happen if I do. And I know this today. I know this. I'll go home and drink a glass of wine, get in my bathtub. It'll be awesome. That'll be it. I won't drink anymore. 6 months later, I'll go, you know what? 6 months ago, I had a glass of wine. I was totally fine. I think I can have another one. 2 months after that, same thing. A month later, same thing. Now you know what? Every Friday night, I suddenly really want to take a bath. So I'm having a glass of wine. And now you know every Friday and Saturday night I'm going to have some wine. And then finally one Saturday, I'm going to say, no, you know what? To hell with the wine. Let's go to the bar. We'll have a good time. I'm going to get totally snowed. And I'm going to go out and look for some gut. Because it doesn't matter how long you're away from it. You'll look for it if you're really, really wasted. And I'll find it, and I'll use it. And then I'll wind up in treatment, and someone will say, when did you relapse? And I'll say, 2 weeks ago at the bar. But the real answer is 2.5 years ago with a glass of wine, right? That's where the process started, where my threshold started to move again. Now, do I know that that will happen to me because I am psychic or clairvoyant in some way? No. Is it guaranteed that that's what's going to happen? No. As an addict, do I want to believe that I would be the one exception in the history of the world? Yes. But I know because I go to meetings. I go to meetings and I work with addicts all day. And I know 15 right off the top of my head who tried just that. It didn't work. They tried with just a glass of wine or a beer at family picnics or just smoking pot once in a while. They tried it, and exactly what I just laid out for you was what happened to them. And so the gift of recovery is learning from other people. I get to stand on the shoulders of giants. Do you know how far you can see when you're standing on the shoulders of a giant? You can see really far into the future. Einstein and Newton didn't go back to 1 + 1. They trusted the work of their predecessors, right? And we get relativity, and we get gravity, and we get all these annoying physics classes that we have to take. I don't have to go back to 1 + 1. I don't have to touch the stove to see that it's hot. Today I get the gift of trusting other people. That's the gift. I get to skyrocket into the future making my own stupid mistakes. I don't have to make your mistakes. I get to make my own mistakes. And that's what recovery is to me. That's what recovery is about. It's very simple, it's very pure, it's very genuine. And I am eternally grateful for it. And I wish nothing but recovery for anyone out there using it. And with that, I will shut up and take questions. Thank you. I appreciate it. Super thorough.
So, you talked a lot about willingness of a person to get clean. So what would be your advice to family, loved ones of an addict if the addict doesn't express a willingness?
If there is no willingness, there is no recovery. It's not going to happen. There has to be some degree of willingness. And it may take a level of desperation in order to get willingness. So as a family member, you may be in a position to force that point of desperation. Say, you know, again, as a family member, you have to treat your own disease by setting up the boundaries. And saying, your using is making my life crazy, and I don't want my life to be crazy anymore. So this is what has to happen. You either have to do what is being recommended, or you are on your own. You have got to figure it out without my help anymore, because I have to take care of me. I'm no good to you anymore if I'm this weak and this sick and this in a bad place. And so there needs to be a willingness. If they're not willing, they're not gonna get well, no matter how much you want it for them. And we cannot decide somebody else's bottom. I see people in the hospital needing a liver transplant, like, right this second, still thinking about drinking. Like, and everyone's going, that's crazy, this is his bottom, he's at his bottom. No, it doesn't work that way. You don't get to decide what somebody's bottom is, only they can. So sometimes that bottom needs to be forced. Sometimes someone has to put something in place that, in front of the addict to say, I don't know what it's gonna take, but I'm not willing to keep giving you what I've been giving you, because clearly that's not working. And so setting up really good boundaries and adhering to boundaries and being a good example in terms of being accountable and responsible. I mean, as a family member, you want your loved ones to get well, right? So you want them to be accountable and responsible and function in society and keep their word and have some integrity. Well then, as a family member, you need to do the same, And if I say to my family member, look, this is what I'm willing to do and nothing more, then that's all I'm willing to do. And I don't make excuses for them, and I don't try to, fix it or change it or adjust my own rules to fit with what they're doing. It's laid out very clearly, this is what I'll tolerate. And that's really the best you can do. And pray. Pray for them, pray for yourself, and get yourself healthy. And get your, I always say this at these meetings, I feel terrible because I certainly don't mean it in any kind of demeaning way, but as a family member, if you have someone in your life that's using, you need to prepare yourself mentally and emotionally for the fact that they can die. That's a very, very realistic concept. They are not the only ones that think they're invincible. We as family members think our family members are invincible. It's not going to happen to them. And the truth is, it happens more often than not. And so part of recovery for a family member is really learning about the disease and how to take care of ourselves so that we are in a position to be able to emotionally handle the loss of a loved one and not turn to the same path that they were on.
Thank you, first of all, for this evening. I first heard you speak at my age some time ago.
I'm like the plague. I'm everywhere.
And I have more of a comment than a question, I guess. Thank you, because if you can do things like this, it's a really sustainable, horrific epidemic. We lost our daughter-in-law a year ago, and our son is incarcerated for the second time. And we've talked about it, and he's 29, so we've been through this for a lot of years. At this point, all we're doing is wishing him well. And through the tough love, through the education journey we've been on, I know that's the right thing to do, but even still, there's times when I feel like it's not. We should stand by someone a little more. But I'm not willing to do that. I pull myself back and say, no, he's not asking for it. But I mean, just in that moment, at his age and everything he's lost, people say, well, he lost his child, he lost his girl, and I knew better than that, but I still hear it. Is there a point where, with all that, you just can still stand there and say, I love you, but that's all I can do for him right now in this situation?
Did everybody hear that? Essentially, what it comes down to is you have a family member, you're using a lot of tough love, wishing them well, but you know that you can no longer enable them. But as a family member, you feel a little guilty, and you feel a little bit like, what if I'm not doing enough? What if there's one little more thing I could do that could help? And you have that sense of what if and guilt, correct? Is that about right? Yeah. Welcome to the world of being an addict. That's how an addict feels. I know if I don't use these drugs, my life will get better, but what if I just have one more and I just feel a little bit better and that's enough to make me not want to use anymore? What if there's just that one more, time that I can go out and have a good time? That need, that constant need to feel like, let me put it this way. When I'm faced with a decision, I have choice A and choice B. The only reason I have a choice is because one of those things is what I should do, And one of those things is what I want to do. If the two were the same, I'd have no choice, I would just do it, right? But the fact that I have a choice means that one of those is the right thing. So it becomes a matter of looking at myself and saying, which of these, and if I'm being really honest with myself, which of these is the thing I want to do? And then I know I have to do the other.
My name's James, I'm an alcoholic.
Welcome.
My question for you is, I've always been one that struggles with religion, spirituality. You said that it centers in different parts of the mind. Is there any way you can better explain that? Like, what religion is to you and what spirituality is to you?
Okay.
Is there like,
Yeah. I can give you the example that
not
I,
that all
sure. Most and a lot of addicts do. Spirituality versus religion. I cannot go into the entire brain complexity because that's like a 2-hour talk. But what I can tell you is this. When you go to the 12-step meetings or you go to treatment, they tell you, find a higher power, right? You just have to find something greater than yourself. That's what spirituality is. It's something greater than yourself. So I said, okay, well, like what? If I go out into the parking lot right now and I attempt to lift up a vehicle, I will be unsuccessful. But if all of us in the front row go out there and try, we might get the vehicle an inch off the ground. So physically, this group of people is a power greater than myself. When I meet somebody of the opposite sex and I'm like, you fall in love and you get all them like butterflies and stuff, that's a chemical reaction. I can't choose who I have that with. I don't get to just like walk up to people and be like, we're gonna have like chemistry. And I don't get to go home and say, I'm going to create this chemistry magically between me and some random person, right? It's just something that happens, you have no control over it. And it almost takes over everything. That's a power greater than me. Because I can't stop it, fix it, change it, or recreate it, right? That's it. That's all you have to believe in, is that there is some force. Can you stop a hurricane? No. A hurricane is a greater power than you. I mean, I could go on and on and on. All you have to do is believe that there's something in the universe more powerful than you are. That's it. And then you have to trust. You have to trust that if there's one thing out there more powerful than you, there's probably something out there more powerful than you that can help you get well. Call it whatever you want. You know, when I go to a meeting, I always start, when I share, I always say, I want to thank everyone in here for allowing my higher power to work through you to keep me clean another day. Because that's how God works for me. For me, the people in my life point out to me when I'm being a jerk. They point out to me when I'm being strong, they point out my good qualities and my bad qualities. They point out to me when I'm not doing the right thing. That to me is a power greater than myself. It's the universe using other people to tell me to be a mirror for me. So that I don't have to constantly, try and fix my own problems. That's a power greater than myself. I don't subscribe to any religion. I don't go to any church. I don't, and I don't knock any of that, because if that's what gets someone there, great. But for me, that's not how it works. For me, it's the energy of the universe. And over almost 12 years, that has evolved to something bigger, which you don't need to have right now. If you're struggling, all you need is that little tiny belief that I can't stop a hurricane. I can't stop diarrhea. I don't recommend meeting diarrhea your higher powers. Anything else?
No.
The American Medical Association, do they have an agenda that educates doctors, like what's done, so, if you go to an emergency room and say you're an addict, and you don't want this drug, that drug, and they say why, and you really don't want to. Like, what's being done to educate doctors?
A very good question, and it's a very politically motivated question. What is the American Medical Association doing about this in terms of educating physicians? They're talking about it a lot. I think that looks good in the media. Addicts and addiction treatment don't bring in money, so a lot of the supports politically aren't going to be there. They did make the addiction medicine an actual specialty now. It used to be a subspecialty all by itself. It had its own little we were like in the bad cabin, I can't, you know? And now they've taken us into the lodge, so it's actually a real specialty now that requires fellowship training and all kinds of stuff. So they are making that, more available, so we're developing fellowship, I started a fellowship at SUNO, so I'm training doctors every year to do this. But other than that, they have me come and speak. The doctor, I'm trying to get into the medical schools, even just to educate medical students. I'm trying to, do more of that. And it's just a very slow process, and it's high on their radar because people are yelling in their faces at them, but it's not high on their radar because it's not a financially driven problem. I know it's not chronically the right thing.
You talked about, like the mix of basically, fixing your brain, coupled with your therapy, and then the prior interacting with the medication.
Mm-hmm.
What would you say, kind of tailoring off her comment, to someone who wants to seek that help, is willing, gets the, I'm not accepting any patients, and the fact that you're only one person, and this is such a small population in the healthcare field. Other than sometimes it seems like ODing or being in a state of emergency is the only way to get that immediate help. What would you say to someone?
So that's a question of access in terms of treatment. And access, we all know is paid for. Obviously, Suboxone is regulated by the DEA, who says initially, for the last 12 years, said you can only have 100 patients on this medication. You can write 250,000 prescriptions for morphine all day long if you want, but you can only treat 100 of those people that get addicted with Suboxone. They recently increased that number to 275. The problem is most of the doctors out there prescribing it are doing it for cash. And so they charge cash, they don't force anybody to work on the frontal cortex, and so the access problem is even greater than it looks, because we think we have all these doctors out here providing, and many of them are not actually providing treatment, they're just providing drug, right? So, I have the same concerns that you do. I am only one person, and I have patients that I see in the hospital over and over and over, detoxing from opiates, detoxing from alcohol, and I have nowhere to send them because treatment is booked and there's long waits. And again, at the risk of being less than politically correct, it is a financial issue. I would love to open a treatment center. I would love to open an inpatient with partial hospitalization, an IOP, an outpatient, and Suboxone, and methadone, and Vivitrol, all of it under one roof, where we all have access with a primary care physician and a psychiatrist, and art therapy, maybe some horses and shit. I would love to do it all. But who's going to pay for it? And I love what I do, but I'm not going to do it for free. I just can't. It's unrealistic. And so that becomes a huge sticking point. Places are not, they want to expand, but third-party payers don't pay. And so unless you have a county that has good county funding that pays for those members of that county to get treatment, you get stuck. It's unfortunate. I would love to see that problem fixed, but unfortunately that's the reality of it right now. But what I do like to say though is, again, what I often encounter is addicts that tell me I can't get in anywhere for Suboxone. And I say, well, I know everyone's full. Where are you going right now for outpatient? Where are you going? Where'd you go for inpatient? Oh, I'm not. There are treatments available often. They're just not the treatments that somebody wants. And so I would say that the access isn't always the problem. It's the addict's brain deciding, oh, I want that. Now, most addicts are going to want the drug that replaces the drug. That's the nature of addiction. Of course they are. But the provider should know that and should utilize it in a way that it's a carrot of a treatment. You're not going to get this unless you're doing what you got to do, when you're engaged. So I do think that access is a problem, particularly in rural areas or very underserved areas. But I also think access is a problem created by the addict because they're not getting what they want. So.
I just want to know when you're scheduled for your TED Talks. Because that would be one of the
Nobody's called me. I should be on
Yeah,
that.
you should.
I don't have to have, if you come to my office to be treated, I don't have to have an hour-long conversation explaining this to you, because you already sat through it, right? So it's a little bit easier. So the more people that are educated, the better for me. I will go to other states. If I have to travel, though, obviously, I would charge. But other than that,
Have you gone to the other states?
I spoke in Pennsylvania. I've spoken in Pennsylvania. Yeah, New York State, not city. Yeah.
Just a quick question. Kelly, you've been part of this kind of community now for a good time. I see the strength in the community, and I see the strength with the addicts, but I also see a lot of the young people forming relationships, meaningful relationships with each other. And I know during treatment that's a no-no, and yet, do you have any observations?
Relationships like romantic relationships, absolutely out of the question. Love, first time love and lust releases massive amounts of dopamine in the midbrain, massive. It is probably the primary reason for relapse. It's absolutely out of the question. That's why all the 12-step meetings and stuff are like, oh, you have to wait a year, whatever. Usually it should be more than a year, but that's so that to allow the brain to reset itself. Because if you don't have your drug of choice, you are going to latch on to love and lust like it's your job. I mean, truly, and in a way that's overwhelming and uncomfortable, But here's the little bit I always give young people. Broken toys only attract other broken toys. So until you're really well, you're not even going to attract somebody who's really healthy. So yes, it makes sense that a lot of people early in recovery are coming together because they're both unhealthy, they both need massive amounts of dopamine just to feel normal, and they're getting it from each other. The problem is, of course, now they need more dopamine just to feel normal, and what happens a month, 2 months, 3 months down the road when they break up, and it's devastating. Now they have a huge amount of stress, and their threshold for pleasure is so high, they have nowhere else to go but to use. It's an absolute trigger, yeah. Developing relationships with other people of the same sex, provided that you're heterosexual, is a good idea. Developing strong friendships is absolutely important. But developing romantic relationships it's like a rookie move. Yeah. I gotta take anybody over here and ignore this section.
Say you're sober, you can take Suboxone. How does it get you messed up, and why is withdrawal so bad?
Okay, so you're clean, and then you take Suboxone. Okay, so if you're clean, that means there's no massive amount of dopamine being released, and you take Suboxone, which is an opiate. So now there's more than what you're used to, okay? And so you will feel different, especially the longer you've been away from using any kind of substance. So you'll feel, you don't really you can't, lots of people report getting high the first few times they use it, especially if you inject it or whatever. But Suboxone is designed, one, it caps itself off. So anything beyond 16 milligrams, you think you're getting more than that, is all psychological. You just have really expensive urine. 16 milligrams is all your brain can handle, physically. And then the withdrawal from it is not, you have to understand the theory of relativity in order to understand withdrawal from Suboxone and methadone. They're both long-acting opiates, which means they stay bound to your receptors for longer than normal opiates. So their dissociation, their coming off of those receptors, is a slower process, which is why the withdrawal lasts longer. But in terms of intensity, let's consider this. You're shooting dope or doing OxyContin every single day for months and months or years and years. You're going to withdraw a little bit every single day, at least to some degree. Sometimes you go into withdrawal for a whole 2 days, right? You feel terrible. Every day you're constantly seeking out the next one because you're starting to get sick. So you experience some degree of withdrawal. So now, you get on this medication and you don't go into withdrawal at all because it stays steady in your system while you're taking it. And so you go through months and months or years and years on this steady state medication, and then you start weaning it off, and then it goes away. You haven't had withdrawal in 6 months, 2 years, 5 years. So to your brain, it's going to seem way worse than anything you've ever had because you haven't experienced it in that long. But in terms of daily withdrawal, it wouldn't be that different. That's all. an opiate. It's an opiate. If you want to never have to go through opiate withdrawal ever again for the rest of your life, don't use an opiate. And that includes medications.